Hi. According to the World Health Organization, the United States is ranked 37th best healthcare system in the world, even though it is by far #1 in cost. According to the latest National Health and Nutrition Examination Survey, 66% of the population of the United States is overweight and 33% are obese. Now, these statistics show that we need to do something different as the way healthcare is practiced in this country. And it starts with each individual's approach at addressing their health concerns. Now, when a patient goes to a doctor, at the heart of that interaction, the patient has preconceived notions and thoughts as far as addressing the health concerns. Similarly, the doctor has certain assumptions that he uses and a knowledge base which he draws upon to assess and treat that patient's health concerns. Now, at the heart of that doctor-patient interaction lies the individual patient's story, so to speak. That story consists of their chief complaint, their past medical history, their family history, the nutrient and supplement intake history, drug history, etc., physical examination, and laboratory tests, so that the doctor can arrive at a diagnosis. Now, in acute or abrupt onset illnesses or emergency medical type conditions, it is all the more important to arrive quickly at a diagnosis. For example, if a patient presents with shortness of breath, chest pain, pain raining down the arm, sweating, you want to quickly rule in or rule out the diagnosis of a heart attack. And therefore, you want to quickly do something to save the patient's life by providing some type of drug or procedure to save that person's life, without much concern for the time being for the side effects of that treatment or that medication. However, the problem arises when you try to extend this acute, abrupt onset type illness approach to long-term health conditions, of which most conditions are. For example, according to the Centers for Disease Control, the leading causes of death, that is heart disease, diabetes, lung infections, stroke, etc., those types of things, develop as a result of processes that have gone on for many, many years that result in possibly acute health conditions. What you want to do is you want to use a system that addresses most of the health concerns that we have, which are long-term chronic health conditions. Things such as diabetes, hypertension, those types of things. With this approach, you want to have an approach that focuses on resolving the processes, the underlying processes involved in those developing health conditions. You want to utilize treatments that influence those processes to steer them to a healthy way without doing short-term harm. And you want an approach that affects these various processes at multiple levels. Now, is there a system or an approach or a method that focuses and utilizes these different factors? The answer is absolutely yes. That approach is termed functional medicine. Functional medicine influences processes at multiple levels. It influences the underlying processes in the disease development, and treatment is based on an approach that will affect multiple levels in a healthy way to promote optimal health. Now, this approach of looking at the underlying processes is not new. In fact, in a 1949 paper published in the journal Lancet, it states that disease entities are not the underlying focus of what we should be focusing on, but we want to focus more on the underlying processes involved in health and disease. Is the functional medicine approach a practical, effective way of influencing various health processes which can benefit many patients? The answer is absolutely yes. I quote from a testimonial given to me from a patient I relatively recently have seen. The patient states in this testimonial, quote, "For 13 years I was on birth control pills to control an otherwise unbearable menstrual cycle. Cycle length would vary from 2 to 5 weeks. Cramping was debilitating enough to send me home from school, and menstrual flow was extremely heavy. Birth control pills were a relief, and I never imagined anything else would fix my otherwise difficult cycle. However, a year ago I started seeing Dr. Husbands with the intention of addressing what Western medicine classified as irritable bowel syndrome, or IBS." And the patient puts in parentheses, "That's code for we have no idea what's wrong with your gut, so we will just classify you as having IBS," close parentheses. The doctor was able to address my IBS by changing my eating habits and introducing high quality and relevant supplements, all of which Dr. Husbands recommended after taking several diagnostic tests. What I didn't expect was that by changing my diet and supplement intake, I would reap other benefits as well. My husband and I decided that we wanted to try to have a family. Based on my history, I was petrified to go off the pill. However, as per Dr. Husband's recommendation, I did, and I couldn't have been happier or more surprised. My cycle was exactly 28 days, cramping was minimal, and menstrual flow was completely ordinary. Even though the results were so great, I still didn't believe Dr. Husbands that I would get pregnant quickly. However, after only 3 months, that is exactly what happened. My husband and I couldn't be happier. Hearing the baby's heartbeat is the highlight of every month." End quote. That is an actual testimonial of one of my patients. Functional medicine is advanced health care for the 21st century. For more information, please feel free to visit my website at drhusbands.com and or my blog at drhusbands.com/blog. Thank you.